How's it going? Afro Economics Live. I'm all in your face. Didn't even realize I was way up on the camera. So good to see you. Thank you so much. Please don't hesitate to chat so I can see you. I know I'm a minute early. That just means I want to make sure I'm on time. Got Miss Davis in the studio from Stone Mountain, Georgia. Thank you, sis. Oh, there we go. How you doing, Benita? Put my little screen up so I can see you. Good evening right back at you. Yes, indeed. It is that time. Afro Economics Live. We're celebrating Black History Month. Part two of our health and wellness, financial fitness. The theme for Black History Month 2022 is health and wellness. And how fitting, because the 10th principle of Afro economics is indeed our health. So I just love that the Black History theme for 2022 includes the 10th principle of Afro economics. And you ask me, how do I know that? Well, I just want to recap and give this wonderful organization its due props again. I'm at their website, ASALH in Ashala, I think they call it that, use that acronym, Association for the Study of African American Life and History. Indeed, that's Carter G. Woodson right there, the author of Miseducation of the Negro. And he established Negro History Month in 1926. Yes, I am a proud Negro. The theme is established each year by the organization, and the 2022 theme is Black Health and Wellness. Like our 10th principle is Black Wealth. The theme for 2022, as it writes, focuses on the importance of Black health and wellness. This theme acknowledges the legacy of not only Black scholars and medical practitioners in Western medicine, but also other ways of knowing. Examples are birth workers, doulas, midwives, naturopaths. I guess I always say natural paths, but that's the correct way. NATURO paths. Herbalists throughout the African diaspora. The 2022 theme considers activities, rituals, and initiatives that Black communities have done to be well, to be healthy. Indeed. So that is at the asalh.org Black History Themes website. Make sure you check it out. Indeed. So I want to make sure that I shared that with you. Thank you so much, Snoopy D. Indeed, thank you. Please, I see you, but I just can't see your name. So please don't hesitate to say hello in your comments, to share. If you have some people in the medical field that you know that are Black history standouts, please use this as a time to acknowledge them and share your information with the great things that they are doing or have done for Black health. So let's move forward. I want to. Oh, look at Miss Sadie White in the studio. My husband Mike in the studio. Miss Davis in the studio. All three of y'all I know are gonna say, I don't want to go on camera. Exactly. I see you, Sadie White. I know, but it's still good to see you. You can stay right there. I won't put you on blast. Got Miss Davis in there doing peace. Miss Muhammad, back to you. You should come because you are a wonderful, healthy, health conscious healthcare professional, and you can share your certification properly. You know, Ms. Muhammad, thank you for all that you do with our Afro Economics Business Network and with sharing your business and then also, just sharing your gifts with us. But please, if you go into the other link that you have in the invitation and you're willing to come on camera, that will be great to, just talk about some of the things that you've seen with people that you are helping. I love you back, and I speak the truth. Indeed, you are doing a great work, and it is getting better every day. Thank you for all that you do, and be safe in your travels to Chicago for Savior's Day. Indeed. So let's. How are you doing, Miss Walton? Thank you for coming in the studio as well. I have I wanted to share this with you, and I'm going to take advantage of the technology. This is an article from 1992. If you have the technology, why not use it? So this was from we're going to use it, the National, I'm going to make it a little big, Journal of the National Medical Association, 1992. And see if any of this, we still are going through. Health equity is a big issue for CDC. Health inequity, became very obvious with the huge disparities in the deaths in the Black community from COVID as a percentage of those who contracted it. The deaths for the Black community have been much higher, and it really brought to attention the health inequities that we have in our current healthcare system. So this is dated back in 1992, before any of what we're still going through existed. And this is the abstract of that academic study. It says the present Black health crisis is a continuum. After 346 years of neglect, flawed efforts were made to admit Black Americans to the mainstream health system. Gains were significant from 1965 to 1975. However, since then, Black health status has eroded. Since colonial times, the racial dilemma that affected Americans' liberal democratic system also distorted medical relationships and institutions. There are clear connections between campaigns to defeat bills that would improve the health of Blacks and other disadvantaged groups and acquiesce with the present reassignment of them to the underfunded, overcrowded, inferior, and public healthcare sector. Physician leadership. This is what they found in the study. Physician leadership helped to establish the slavocracy, create the racial inferiority myths, and build the segregated health subsystem for Blacks and the poor. Clearly, if the history-based health disparities are to be resolved, Black physician leadership will be necessary. Without justice and equity in healthcare, the dream of Martin Luther King will never become a reality for African Americans. And in the speeches, really, King never really talked about healthcare. But yet, the reality is that the discrimination and the inequality and the not having access, has And just the thought, like the stereotypes that make things very difficult, have made things even to this day very difficult for our community to get equal service. Even when they have gone to the hospital for COVID or dying in many cases, put to the side and pushed to the side. So this is what this article was talking about, that it's the physician leadership that has allowed this to go on this long. And that we need to get more physicians that are concerned about this issue involved in changing the system. Now, of course, this was before the article I just shared was before the Affordable Healthcare Act was approved. Now, Ms. Pritchett, I hope that you'll come into the portal. How you doing, Mr. Jones? Good to see you. Hello, Star. Good to see y'all. And then H. And we have all these people in the studio with no cameras on. Did you try to get in? Tell me, Ms. Pritchett, if you tried to get in and somebody else will go out so that you can get in. If they won't, I think it's going to tell me when it's full. It's not full yet. But you all that are in, please turn on your camera so that we can all, so we can talk. Thank you, Miss Davis, for having your camera on. But I know you have so many computers in your set and your setting that you get a lot of feedback. When you come into the studio, this is what Mr. Jones suggested, and I agree. When we're in the studio and you come in, stay on mute when you start, and when you talk. So, but be on mute when you're not talking when you come on, so that we don't have that echo. I think. But we literally, I see you all, and there's someone named H. Yeah, how you doing, Mr. Jones? Thank you for coming in with your camera. That's a team player, right? Indeed. So, if everybody would just turn on their cameras, that would be great. If I did, I don't know. There was someone named H, and I bumped him out because I don't know who H is. We got a lot of H, but I don't know who it is. It could be anyone. But please, everybody, consider turning on your camera. Sadie White was like, "I'm scared. I'm gonna turn. You really should. I see you, Sadie." But so I hope you just, I went off with trying to talk about our participants. But the reason that I wanted to make sure that we continued this discussion from last week was because we were in the middle of the discussion, and then all of a sudden it wouldn't you couldn't get my audio. So then everybody was like, "Oh, let's do this again." So we did this again, but we were on a roll last week, and I want us to continue to maintain that enthusiasm about why it is so important for us to be healthy and how much it costs us when we're not healthy. And I think that, it's easy to lose your enthusiasm about the things in life that are really most important to us. And I would hate for us to get to a situation where it is publicly said that there's not a problem with inequity in healthcare. It's just that they don't care. That would hurt so much if we have to hear that there is a lack of interest in our own health. That is why, you know what I mean, that we're not getting, that we're more likely to have these challenges. When we get here, I was looking at some research, and it was sharing that the suicide, you're talking about a mental health perspective, the suicide rate, which is amazing, that I'm gonna bring you all in. The suicide rate for actually black adults is lower than white adults, but the suicide rate for black teenagers is higher than white teenagers. No, it's opposite. White adults had a higher suicide rate, but black teens had a higher suicide rate. And I was thinking out from a mental health perspective, how we could address that. And I think a lot of that is going to have to do with us making a point to and looking at parenting styles and how we're addressing stressful situations and how we're teaching the young people how to manage stress in a healthy way. And then it also is noted that if there is a black person with a mental health problem, they are less likely to be given the proper medicine that they need. And they're more likely, this is really disappointing, but a black person with a mental health problem is more likely to be in jail than a white person with a mental health problem. So they're locking up people with mental health issues, that who are not in control of what they're doing. That's really sad.
I
And these,
agree. I agree.
and these numbers are real. So, but it's stuff, things that I think that is what, like with Black History Month saying we want to look at, health and wellness, we need to make sure that we include all parts of our health. And we also need to look at how are our financial decisions impacting our health. I think, what were you going to say?
I was going to say that also what plays a part also is in the black community, we don't seek out that mental health. We don't seek out that treatment.
Yeah, we don't know, we're less likely to know where to go to get that type of help. We're less likely to have um ready access to the resources, and then when we do go in, we're not getting like the proper, if you're not getting, like, I have a Facebook friend whose father was killed by a cousin that was supposed to be on medicines, but was let out and wasn't being watched correctly if they were taking the medicine as prescribed and things like that. But it was a mental health issue. And and then so now we have a person who has done something that they don't even realize what they did, and you have a father who's gone. You can't get back. And that is unfortunately also in Virginia. They just created a law, to address mental health calls differently. To not, if you think that someone has a mental health problem, that, like, this young man was naked, and they still killed him, and he was standing there naked. So
I heard about one today, JB, where he was handcuffed,
mm,
naked,
mm.
and they still shot him. They didn't kill him, but he is paralyzed.
Oh my God.
Yeah.
But there was a man who was naked on the street, handcuffed, and was killed with a mental health issue. His brother called and said, "My brother is outside naked." He had no idea that the police would kill him, and they killed him. And he was just out there having a breakdown. So in a lot of the mental health reactions or the irrational reactions, are often caused by chemical reactions, a stress reaction. It could have, been a medicine that there one. Oh, I had an assistant one time. Her doctor switched her medicine. She died in her sleep.
Mm.
So there could be people taking a medicine for something else, but it causes an imbalance and creates a mental problem or kills them. There are so many people who have died from prescribed medicines, including Prince, Michael Jackson. Think about it. I don't know that we really have. So I want to look at. I want to. I want to look at. I want to look at the CDC's definition so that you know that what they're saying health equity is, and this health equity has to go across all mental health as well. And this is health equity is achieved when every person has the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or other socially determined circumstances. Health inequities are reflected in differences in length of life, quality of life, rates of disease, disability and death, severity of disease, and access to treatment. Because often we get diseases, but we get it earlier. So the earlier you get it, like the average age for a dialysis center overall is now 55 years old on dialysis. So if you looked at just our community, it might be lower than 55, but it is. How you doing, Diana? So that's, also when I think about it, I've known several people to tell me that the reason they don't walk more is because they don't feel safe in their neighborhood. They don't feel that they can just go outside and walk. And I don't think a lot of people don't realize that it's not so easy in an urban area, you know what I mean, to just go outside and take a 2-mile walk like Miss Davis does in Georgia. It's she can walk 10 miles. She still feels safe. Star can walk 100 miles. It's like just 1 mile. Yeah, right. But I mean, you would just go, yeah, you probably only go a mile, but you could feel very safe because, there are people who probably don't feel comfortable a block. And I feel that in those areas, they need to do a better job as far as for health equity with giving them public gyms that have a guard, you know what I mean, and have facilities with treadmills, and services to those tax-paying citizens that they can, or set up a bike trail or set up a park that has a walking trail, and access. But the lack of fresh air can diminish your health and can also diminish your mental health a lot. So the things that, that take for granted, are actually representing, you know what I mean? That Jenny said she can walk. Well, I'm glad, Jenny. I can walk. Yes, you can. She got a lake and everything. But millions can't. Millions can't. West, east. What were you saying? But let me see, I'm going to take that down. Clinic doctors for poor Black people are, oh, wow. Wouldn't that be something if they were making money? Wow. That, would be sad, but a lot of money has been made. Unfortunately, I mean, if you think about it, even with Planned Parenthood, they made a lot of money on babies that didn't live, on abortions. Not to get political, but that's basically what he's saying. You know what I mean? That sometimes things are brought to our community, but they're just used to make more money off of it. And then there's nothing brought, like they made billions on that. And then nothing is brought to the community in exchange for the money that they're taking away. And the so let's move forward in practicing preventive medicine. Really like preventing illnesses, prevention can save you so much money, because nowadays it is so hard to get approved for disability. That's what's so sad. It's like, I wonder how disabled a person has to be in order to be approved. Like, what exactly are you looking for? What else exactly are you looking for? If they cannot go to work, how can they eat? So, and then they'll turn them down kind of as a formality. Then they have to go through another year or two broke, reapplying. Then they finally approve them. Some people die during that time, and some people lose their home. Some people, this is people generally who have worked for years, have put money into the system. All they're basically trying to do is get their Social Security. You know what I mean? A little early. That's it. And because of the fact that they're disabled means that they're most likely going to die earlier than anticipated. So you're not really giving them anything, because they're not going to live to, the longest length that somebody that starts at 70 would get. They're probably going to live to 100. So the 70-year-old might get more of a payout than the person who was disabled at 50, who might only get 20 more years. That's something. But yet they get turned down and turned down and turned down. And then until they give in and they go, well, I'm going to go over here and pay this person. So then they've been turned down for 2 years. They owe them $25,000, say $40,000. Now they had to hire this law firm who just turned it over to a clerk. And then the clerk takes half of what they're owed. Takes half or more of what they were supposed to get. So they can't even get ahead. They're not even really getting caught up. And that's their money. Yeah, look, Ms. Daniels said you have to get a lawyer to fight your case, and that is ridiculous. You really shouldn't. I help Afro Economics members all the time apply, and if you don't get approved, all you gotta do is apply again. Just do it again. And do it again. It's not designed for you to have to give away half of your money like that. It's so sad. Or more. It should be against the law. It should be some sort of like public program to help people apply for it. That is sick. It should be, if you turn me down and I reapply and I'm approved based on the same information I gave you last time, they should pay you interest and penalties for doing that to you. Right?
I agree.
It really should. Exactly.
Yes.
Ain't nothing changed.
Yes.
That is horrible. And I'm going to look at, so practicing prevention and trying to avoid having to, be out of work, because 75% of our annual health costs of what people are spending. So if they're spending like $1,000 a year, 750 of that money, $750 they're spending on chronic and preventable diseases, according to research. But, we have to be aware of, okay, what do I need to do in order to help? prevent this. We're not talking about when it's already something there. You already have something. You already know. But about like the people who you are pushing your luck and you're good. What do you need to stop doing so that you don't have to stop work any earlier than you want to? Mm. Because I really think that the best thing that I can do for our community through Afro economics is to really reiterate the fact that less and less of your health care is covered by insurance. Less and less. More and more money is coming out of pocket. Even though, and especially for your seniors, the people on Medicare, who think, I can't wait. I can't wait till I get on Medicare. And then you find out that such and such a lab work is not even covered. Such and such, that's not covered. So and so, that's not covered. Oh, no, I got to pay that. Oh, wow, that's not even on my plan. Oh, man, that is happening over and over and over again. So don't think, everything's going to be just great. All I got to do is if I just get to 65, I get on Medicare, everything's going to be fine. Do everything you can to get to 65 that without having health, any extra health issues. Anything, do everything you can, which includes, in my opinion, regular checking of yourself. Like you don't prevent blood pressure by checking your blood pressure. You check your blood pressure because you want to know, am I doing something wrong? That's why you check your blood pressure. You don't, if you get a blood pressure machine and you want to monitor your blood pressure, you're doing that because you want to take steps to bring your blood pressure down. Taking the blood pressure medicine is not a solution to blood pressure. And people go, oh, you better take your blood pressure medicine. Remember, they used to run commercials and everything. Take your blood pressure medicine, black man. Exactly right. Remember, it was like a black guy in the commercial too. I made me look.
You're talking about the commercials. I've been teleworking for the last 3 years or since the pandemic, and all I'm seeing is commercials where they're pushing medications for everything from head to toe.
Wow.
And another thing, I'm wondering, is that what I'm gonna have to go through when I retire? Watching. And a second thing, the case of where insurances are covering less and less. I've had Blue Cross Blue Shield all my career, and within the last 3 or 4 years, I go to the dentist and get a cleaning twice a year. And I just get a bill at the end of the year for the copay. And then it started increasing. And when I asked, what is this increase?
Amen.
Blue Cross stopped covering x-rays.
They stopped covering that. See?
So I have to go to the x-ray.
And you supposed to know that, right? You supposed to know that. You supposed to go and ask when they know for 20 years they've been covering the x-ray. Yep. Now all of a sudden, it's like, I don't need no x-ray. Look, cavity is when you see the cavity. You don't need to look.
You break a tooth.
You see what I'm saying? I'm coming in for cleaning only. Yes. But the best thing that you can do really is your overall health. I was telling you about one of our members is a dentist, and he was talking about how integrated our dental health is to our system, because some people with teeth decay, I'm talking about people they don't need no x-ray. You can see it's rotten. That stuff chips off and goes into their heart and causes blockages and stuff. And they also found some teeth decay, he was saying, in knees, causing people knee pain, making people have to get knee surgeries and stuff. It is connected, but with proper nutrition and proper maintenance, that we can actually, prevent a lot of dental issues. But you gotta floss every day, brush twice a day, and use rinse. You know what I'm saying? Like that, you have to. It have to. Like, and I don't know if everybody flosses on the regular. Do you think everybody does? Like, that should just be like a regular. I just feel, but I know when I was growing up, that was not a lifestyle thing. Like we didn't keep, like it was only, right? It was only when we went to the dentist and he'd tell me I had another cavity. And then he'd go, you gotta floss. And then that was when they had this one and you had to, go all like that. And now they got the cute little ones. And my daughter grew up with that little one, the cute little ones. So she's always flossed. But I at one point had like, I don't know, I think it was like 10 cavities. And my parents filled them all and they were all baby teeth. They all started coming out. My mother was so mad. I was like, isn't that like a question you should ask? And I don't think that I've had a cavity since. Like that was more than enough for any person in their whole life. That was so dramatic. Oh my God. I was like, so she was like, oh, she has all these cavities. Oh. No, I don't even know if I could have all those. But the things that people get away with that we need to be checking. First of all, if you see a child has a cavity, most likely it's from some sort of food allergy, which it is. I was eating cheese and wheat and stuff all the time. And I did not realize I really cannot eat cheese. If y'all hear me making noises and things like that, you'll know, oh, she must have been packing in some cheese.
Mucus.
As long as you like that, if you can kind of discover like what it's food, because then what happens is it creates plaque and sugar. We used to eat sugar all day long as kids. So just, sugar creates that plaque and all of that, your blood sugar is elevated. Don't take that for granted. Young people, especially in our community, are getting diabetes on high rates now. Babies, little kids with type 2 diabetes. That means that's obesity onset. That's preventable.
Isn't lactose a form of sugar, or does it break down sugar or something like that?
What'd you say? Is what?
Lactose. The lactose in milk isn't that?
Oh yeah, and I'm not, and that processed milk too. You know what I'm saying? And we didn't know. We didn't know. Because I know Miss Muhammad would say we should not drink that pasteurized milk. You know what I mean? At all, just because it's so processed, there's no nutrition really left in it. I mean, you get some raw milk. Woo! She brought me some raw milk, and I was like, wow, this is how milk really tastes. But yes, Miss Person said they fill baby teeth and do crowns on them too. Money making business. That's scary. But I'm gonna tell you one thing. Now, I wouldn't be surprised because pediatric dentistry is the only dentistry covered with the Obamacare. So pediatric dentist. So you have more and more. Have you seen it? More and more dentists focusing on kids because they can get the government money. The adult dentistry is not covered. You have to have your own policy. So yeah, I bet they are crowning them up, and they and not telling us about the prevention. Like this is vital. And I think one thing that changed my life was going in and the dentist's office said, only floss the teeth you want to keep. And I was like, and then having such a traumatic childhood, I remember asking them like, will I have my teeth? Because, and they were like, oh yeah. I was like, whoa. Oh. But I really was just like, are they all, what's going on here? Yeah, Miss Dickens. Floss daily to prevent also like that gum disease. Like take the floss and get it in there. that gum disease is a killer, and it would just make us sick all over. You know what I mean? I would be amazed to see the research connected with gum disease and cancers growing in people's bodies. You know, because we're so connected like that. We are one. We're not like this and that. Like, you know what I mean? We're one. It's in there in your gums and you're swallowing it. So then I wanted to express that I just have this vision that Afroeconomics can be about creating a healthier and wealthier, Black community, that we can build, all of that, because there's really no reason to be. I mean, could you really be happy and you know that the one thing that you want you cannot buy? Right? I think that the more and more I see people establish wealth, the more and more I see them appreciate good health. Do you see me? You get me on that? Like, because the more money you have, the more you realize you can't buy health. You cannot buy it. You got to put in work for health. You can buy looks, you can buy everything, but you cannot buy your healthy blood. You cannot buy, like, you know what I'm saying? Like, people can go out there and do Botox and get, they can even go and get fake teeth, but it doesn't make your gums healthy. You see what I'm saying? You still have the most important part, is the gums. And it's like that, that blood, what's in our blood. So I say that we have to be proactive and be preventive and never, ever give up on our health, and never feel like I can't be renewed, I can't be refreshed, that I can't, start this over, that this can't get better. I know that we can be healthy. I know that people have been at their deathbed and made a commitment that this is how I'm going to live now. And they have renewed their life. It's just work. It just takes a process. But I'm going to continue to just push it, because, I know that as an entrepreneur, that I've constantly been under stress, constantly, every day. You know what I'm saying? Every day, like, it's on me since my 20s. And the only thing that helps you in those situations is learning how to deal with stress in a less harmful way. You know what I'm saying? In the least amount of harm, to yourself, and learning how to control your emotions, because the, stress, and if you react improperly, all you do is harm yourself. And most entrepreneurs, and this one brother wrote this book, and he said corporate America is killing Black folk. It doesn't have to. Entrepreneurship doesn't have to kill us. Corporate America doesn't have to kill us. The government doesn't have to kill us. But we're going to have to carve out parts of our day that are about our health. Like, I have to go to bed at night, because I realized when I started overworking and adding on and taking classes and things like that, immediately my health started to decline. Immediately. I had to readjust that that's what I want, but this is my priorities. You can only do what is your priority. If you start adding things that are not your life priority, then you're going to, be moving away from your ultimate goal, because mental health requires that you be happy with your life. So you can get all your money right, but then you look at yourself and you're unhappy. So you can look at yourself and then be broke and still be unhappy, right? Like, you're like, well, all I do is walk. All I do is walk all day, or all of you, you can't do that either, But we're much more likely to go on the side of just sitting and eating all day long, especially during this pandemic. And that's why we've seen more people get sick over 2021 than got sick in 2020. You know what I'm saying? There were more. Like now, people keep saying, oh my goodness, everybody's dying. Everybody's dying. But it's because of the compounding effect of doing things that pull down your immune system. And your body is like, at what point are you going to let up? And then, or here comes the virus. Oh, they've been sitting over there, not taking care of themselves. I'm coming. And then you are like, I'm good. It's not going to get me. And then boom, one false move, your immune system is weak. It could have been an argument. It could have been, you know what I mean? Anything. You just got caught off guard. And the only way to not get caught off guard is that we have to always be doing every part of the day. We have to be carving out how I have to take care of myself. And a lot of us, it begins with making sure you get proper sleep. It will start changing everything. Like, you know how first of all, like if you thought I was going to say something, wouldn't you have thought the first thing I was going to say was exercise? Get exercise. That's what everybody says, right? Just get exercise.
I would have said sleep. I would have said sleep.
You would have said sleep. Good for you.
Yeah.
You would have said sleep, but you would have thought I would have said exercise, though, right?
Yes, yeah.
You know exactly. You were like, but in reality, if the person doesn't have sleep, they do not feel like exercise, right? Even if they do it, the only reason I feel good at 4:00 in the morning is because I go to sleep before everybody else.
That's right.
That's, you know what I mean? That's it. I gotta go down. And it can't be broken up. You know what I'm saying? It can't be, you have to like make a commitment. And I still don't get enough. I really want to work on like getting more rest, because I know that it will contribute to just me being able to relax more overall and not being hungry. Like a lot of times you're sleepy, but you eat because it makes you keep going, you know, or a person will go for some more caffeine. And in reality, a good habit to have is to do some caffeine. It says that like green tea and coffee are supposed to be good for us. You know, I'm gonna read you the info on it. I was like, oh, okay. I've started doing the green tea every day, which I did not like green tea, but I found like there's so many different versions of green tea. You really have to find your one that you can take. But it says it has polyphenols and catechins are in green tea, and this could decrease your risk of cancer, diabetes, and heart disease. And coffee is linked to lowering the risk of type 2 diabetes, heart disease, and cancers and brain ailments such as Alzheimer's and Parkinson's disease. Gotta get your coffee on too. Both coffee and tea drinkers benefit with a 20 to 30% lower risk of early death compared to non-drinkers. Just remember that too much caffeine can lead to anxiety and insomnia. So then you mess you up. Look, so you can't sleep because you drink too much coffee. I know, right? I know. I only drink that one thing. I don't drink any coffee. I drink that one green tea before I go to the gym. If it's a day I don't go to the gym, I don't even think about it. But I make it before I go to the gym, you know, and then that's it. Like, you know, maybe I should, you know, drink. I don't know. I obviously don't need it. You know what I'm saying? Like, I'm still up. I've been up since 4:00 this morning.
You good? You good?
Exactly. I feel good. Look. I'm so glad that I'm not, because coffee can be so addictive. You know, I know a lot of people that are addicted to coffee. Just none of you. I know you're not, Weeda. Oh yes, Weeda. Water. Ms. Muhammad said, sleep. You're on it. That is right. Which brand of green tea do you take? I was gonna tell you it's called kombucha. It's like kombucha. I'll send you the picture, Miss Person. But it has that kombucha. I always say that word wrong. But that
Kombucha.
kombucha, yeah, kombucha green tea, and I'll send you the picture of the brand. But it actually, to me, it tastes better. It's the only one, and I also have a jasmine green tea that I like. But that kombucha, yeah, it's a little I don't know, it's kind of become my favorite. And no sugar. That's right, Jenny. If I want something, I'll do organic stevia. I'll put a couple drops of that in. You're welcome. Indeed. And the so then also, so let's look at we're gonna close out with some healthy habits, getting enough sleep, exercise, but y'all know I love to lift weights, right? So look at this. Look at this. Strength training increases lean muscle mass. It gives your cardiovascular system places to send the blood being pumped. This results in less pressure on your arteries, which helps reduce the chances of heart-related problems. Basically, lifting weights helps with cardiovascular. Isn't that something? Never do we hear that, right? They go, like cardiovascular go, oh, go running, go run, go ride the bike, go so and so. They're basically, this research is showing now that you could skip the run and lift the weights and you'll be good. But how many, you know what I mean? How many people are really told? Here it is. Reduces the risk of heart attack or stroke.
I heard that years ago, JB.
Did you?
Years ago.
Good. That's why you so muscular.
Funny.
I should have known. Yeah.
But I heard that years
ago. Not. But you know what? I think a man is more likely to hear it than a woman, because a woman has no problem saying, I don't lift no weights. I don't do that. You know what I'm saying? Like because we're not encouraged, and nobody's telling the woman, you know. But as we grow older, the woman and a man are about the same percentage, same chance, especially for Black women and men, to have a heart attack. And then they might find out that and Black women have heart attacks way too often. And what if we find out it's contributed to that she's not keeping her muscle mass up? You know, because we have very strong legs, you know, and as you're aging, it says women start losing muscle at 30. Men start losing muscles in their 40s. So it's declining. So it affects our bones. It affects our joints. It affects, and so many things. And then the woman sits all the time, and the man, sitting at the desk. And that's where I realized how important it is to lift weights, because of standing so long, especially during COVID, standing right here at this space, like 12, 14 hours a day, just going in, boom, 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 boom. That first year, my legs got weak. And I didn't even realize it. You know what I'm saying? So now I have to, you know what I mean? I'm just like, no, I'm going hard. And it's hard, but the gym wasn't open. I couldn't lift as heavy, and thinking about it, I was just thinking, I'm active. You're doing a little virtual stuff. Didn't know. We have to do some resistance. So, if anything, please think about that. Definitely get your regular exercise as well. But walking is so powerful. When I was walking this morning, this little lady, she's about 5 feet tall, and she was just walking all past me. Ooh, let me just scoot on by. And I said, scoot on by. And then when I passed her again, when she stopped, I knew she wasn't gonna go as long as me. I knew she could go faster, because I don't care about the speed. But I knew she go faster, but you're not gonna go long. I got the endurance down. So after she stopped, I said, baby, I know you faster, but I got a bigger load. Bigger load. Gotta carry this thing. 18 wheeler right here. You a little Yugo. Go on. Zoom. But just keep walking is so powerful. So powerful. And it just helps. I just like meditate when I walk. But if you're not keeping up with your steps, you would be amazed at how much we just sit around now. Right, Star? Like you have to make an active effort to keep busy. You have an active effort. I try to walk to carry my watch to wear my watch now that keeps up with the steps. Cause I was shocked when I started wearing it. I was like, oh my goodness. How you do like 1,000 steps for the whole day? It's scary. And then we have a member, he's a postman. He does 15,000 steps just from working.
Wow.
I know, right? Just from working.
That's
Download. You can download? Yes. Mine has like I have the Samsung watch and the Samsung app, and the app is on the phone and it's on it. So I can use the phone or I can use the watch. Yeah, exactly. Rosita said she heard strength training for women is our friend. It is our best friend. It really is. It helps with, definitely with burning fat because it keeps up our overall metabolic rate. Like, we're process even though we don't realize it, but body composition is so much more important than just what we weigh. And if we can move away from our fascination with weight and work more with what is our weight made of, like start measuring our body fat, then we can know that you're transferring fat over to muscle and you're becoming a healthier person, not just, losing weight, because a lot of people have lost weight over COVID, but if they measured it, they actually lost muscle, and that's so dangerous. So we need to, when we say weight, make sure we know what it's made of. Not losing all weight is not, it's losing, you don't want to continue to lose muscle. And if you don't know how to check it, how to calibrate it, I could talk to you about some different resources on places that you can go. I know if you're a member of a gym, they should have the right instruments there for you to do it. And I would check it at least every 90 days. I do it every month, every week, but that's just because I'm training. But I try not to, look. I used to like everything was about weight, and then I realized that that's ignorant. It's like you have to, especially when you're trying to get stronger, you have to focus on what you're made up of. One of the oldest women, yeah, exactly. We all know about Ernestine Shepherd. Yes, indeed, indeed. I have to get in the game and do strength training. Yes, you do. And she does look great. She don't look as good as you, Miss Davis, but she looks great. She can't hang with you. She don't have no big afro like you. But she looks great. So getting enough sleep, exercise, water, keeping up these habits, and drinking the water habit. Prevention is our key on how we're going to keep our money in our pocket for as much as possible. I had a member the other day, and she passed away, but I was loving the way she passed away. She just said to her husband, call the hospital, and she just died. Ain't she something? You got to know her, boy. She's something else. And when her girlfriend called to tell me, I said, wow, what a way to go. You know what I'm saying? No drama, none of that like that. She said, he said, that's what he told her friend that told me that she just said, call the hospital. No drama, no scream, no yelling. And, So we all got to pass one day, but you know, it doesn't have to be years and decades, you know, of spending all of your money. It's very expensive. Maybe hopefully we'll be able to, you know, turn some things around for us. It is a constant challenge. It is a constant challenge. Constant challenge. But at the same time, what else is life about than with living it? Right? Like, you know, how can we like not feel like that we have to include some part of our day that's just for us? Even if you just sit and meditate, you know, we need some time that is just for you. And we just weren't told that. You know what? Hey, here's an hour. Just take an hour and just meditate. Just take an hour. Like, you know, sometimes I really feel like that's a big reason why I get up so early, because it just gives me time and to just think. You know, just be, walk, sip tea. Yeah, feed your spirit. It's like Miss Hill Fleming said. You know, just feed our spirit, feed our mind. You know how they say, like, oh, you know, exercise helps with your mental health, but I think that exercise or movement, you know, just movement, even if it's just walking down the street, socializing, being around other people, participating in things like this is good for you. I bet if you check your blood pressure before talking about someone, hopefully you feel how much I care about you, that your blood pressure is lower from a positive life experience, you know, of interacting, you know, of making, I think sometimes like making comments and saying things. I know Miss Davis, she over there typing and stuff and then laughing at herself, and you know what I'm saying? Like that, every time we laugh, you know, we're putting oxygen in, we're detoxing, we're taking out that bad stuff. Look at her. I see you. You know what I'm saying? He's exactly where she go. Look at that. Oh, she look perfect. You know.
Yeah, you put me in time out, so I had to stay
always. I can't believe you didn't come in blasting with an echo or something. I know. That's her. We love you though. We love you. But don't you feel that? You know what I'm saying? Don't you feel that? Like, you know what I'm saying? Like, I mean, she's worked 2 jobs for like 30 years. 2 full-time jobs, 30 years. It's amazing. And don't complain about nothing except for the stock market going down. Takes her walks and stay active. That's
about it.
What'd you say?
Yeah.
Yeah.
And JB, you know I'm gonna have that beer now and okay.
And the beer. I mean, she just had to add that in there, right? Exactly. Well, that's one thing when you look at information. It always says, like, it never says stop drinking. It always says limit alcohol. I was like, I wonder who the alcohol people are. You know what I'm saying? They go, no sugar, but they don't say that about alcohol. Isn't that something? The sugar people don't have the connects that the alcohol people have. I think it's because the government makes more money off alcohol drinking and consumption than it does off candy. That would be so sad if that's true. That would be so sad.
It is true. And here's how you know. When everything was closed down, that was an essential business. It was an essential business.
Right? Yeah.
They allowed you to take it in the street. They allowed you to take the alcohol with you.
Exactly. They were like, stop. They sure did, didn't they? They were like, well, you can't come in the restaurant, but you can come and get some beer. That is so true.
Yeah.
That is so true. They're like they're gonna let people run off the road. That is so true.
Well, they claim if you put a steel top on it, you're supposed to leave it like that until you get home, I think. I'm like, who does that?
Look, this guy was exactly. They were like, this is good. It's all good. Yeah, look, I know. We got Super Bowl weekend coming up too. Everybody, we got to be good.
Yes,
we got to be good. I'm gonna be real good. I know Michael's right now probably figuring out how many wings he gonna get and from in what place.
Or can he get them? Or can he find them? Isn't there a wing shortage? Chicken
really?
Shortage? Yeah.
Well, that would be good though.
Not here in DC. I got my wings.
Did you buy early? You bought them early?
I did. And I went to the Amish market. I didn't go to the supermarket. I went to the
he got some real chicken. He got some real stuff. I'm good
to go.
And you just have to put it in the oven.
I'm gonna put some in the oven and I'm gonna fry some.
You just acting up. That's so good. Watch out. That's right. You know who's gonna win. The Bengals. Yeah, I gotta make sure I say it right.
Why
you don't think so? You don't think
so? No.
Just one of these young men that plays for them, Spain. He's from Petersburg, where I went to Petersburg High. Yeah. And so we're all proud of him. So that's why. Why you don't have a story like that for the Rams? What's your story for the Rams? Why the Rams?
My story for the Rams is this: what Denver did to Von Miller and Cleveland did to Odell Beckham Jr. and Matthew Stafford in all them years on a bad team being the best player, I want it for them.
Oh, that's way too detailed for me.
I know, right?
You lost me. You lost me. I was trying to keep up. You might as well have been talking about organic chemistry. I was like, what? I know what they did. I can't believe they did that.
They traded Von Miller for no reason with no
I can't believe it. That's crazy. I should play along better.
They did him dirty in Cleveland. So, yeah, I want that for them.
Star. They did him dirty in Cleveland, girl.
Dirty.
That. We're like, you see, you lost us. We're like, we don't know.
It's like talking to my queen. I know.
Hey, look, and you know, Mike didn't even try to help you out. He's just still chilling.
Mike tapped out.
He's down there. No, he is hearing your every word. He is eating that pizza. He ordered a pizza. He said, it's Wednesday. I'm ordering pizza. That's all right. And I sit there and look at it too. I don't touch it. I'm so proud of myself. I don't touch it. Pizza, he acts up. I don't touch it.
You can have a slice.
No, don't even do it. I know, but it's kind of like a crack addict doesn't go into a crack house. Let me just tell you. You don't mess around the house. That is me and pizza my whole time. If they would, I probably got interviews somewhere where people asking me what's my favorite food, and I said pizza. Exactly. I used to love pizza. Yeah, it'll be a while, but I'm gonna have me another slice for my 30th anniversary for the business. We're gonna have a pizza party. What's that gonna be? 3 years, 2025. Yeah, we're gonna have a party. We're gonna have some pizza, some wings.
You know you're being recorded, right?
Exactly. I better make it happen, right? Exactly. I better make it happen. Hey, yo, well, I love y'all. Thank you so much for sharing and coming into the studio tonight. The bottom line is it's Black History Month, and it's all about health and wellness. So make sure you do what you're doing. All of y'all can keep riding your bike. Keep walking your walk. Miss Davis, don't stop the music. Do it. You're doing everything. She's showing us all up. All right. We're going to do this. Keep doing what you're doing. Love you too. Miss Lynn. Yo, have a good night, y'all.
Everybody have a good night.
I will be right here. Don't forget, Friday, we have business to take care of.
Good night.
Members only Friday at 10 a.m. See y'all later. Good night.
Good night.
Good night. Good night. Good night, Miss Daniels. Back at you.